Hi, and welcome to another episode of Growing Up. Today, we will be discussing babies' development in the third trimester, as well as getting ready to meet them anytime soon. But first, Bespoke Janae. Starting the third trimester, week 28 to week 31, your baby is completing the formation of all major internal and external developments. They can open their eyes widely, they can kick, stretch, and make grasping movements. At 31 weeks into your pregnancy, it's time for baby to gain weight. You might find yourself increasingly breathless as your growing uterus crowds your diaphragm. It should ease a bit when the baby drops lower into your pelvis later in pregnancy. 32 weeks into your pregnancy, your baby's toenails are visible and their fingernails are growing. Their hearing is getting very sensitive. And when you talk to them, or in my experience, when you talk to them, they move. Pregnancy may be starting to lose some of its glow. And this is about the time when people start having their baby showers or their sprinkle. By week 33, your baby's bones are hardening. And by week 35, their limbs have a chubby appearance. And then by week 36, your baby's lungs are fully developed. And then also by that time, your baby is now really crowding your uterus because he's bigger now. And it's making it very difficult for him to punch and kick you and all of those stuff. But you would probably still feel a lot of stretches or him rolling or wiggling. At 37 weeks, your baby has a firm grasp, which is awesome. And then he's also preparing for birth with his head descending into your pelvis. And while further growth and maturing is taking place for the following weeks, labor is becoming imminent. Now remember, your due date is simply a calculated estimate of when your pregnancy will be at 40 weeks. It does not estimate when your baby will arrive. It's normal to give birth before or after your due date. My firstborn arrived a week before his due date, and he looked pretty matured and fully developed. So today I am 34 weeks pregnant, and as much as I am over the moon with this phase of my pregnancy, I am acutely aware that labor can be knocking on my door unexpectedly. So I read up about premature labor just to prepare myself in the event it may happen. So labor is premature if it starts before 37 weeks. Now, there's a lot of things can increase your risk of premature labor. Some of them are being pregnant in your teens or older than 40, smoking, drinking, and drugs, having health conditions such as high blood pressure, preeclampsia, diabetes, blood clotting disorder, or infections, not getting good prenatal care, being pregnant with a baby that has certain birth defects, being pregnant with multiples, a family or personal history of premature labor. To prevent premature labor, it is important to know the warning signs. So some of the signs would be lower back pain, abdomen or menstrual-like cramps, contractions that happen every 10 minutes or more often, increased pressure in your pelvis or your vagina, and then fluid leaking from your vagina or vaginal bleeding. Now, if you are diagnosed with premature labor, you may need to receive some medicine to relax your uterus and stop labor, such as tocolytic medication. Now, they can delay labor for 2 to 7 days, and your doctor would want to delay so that they can give you steroids that can speed up the development of your baby's lungs. Now, remember, your baby's lungs are fully developed at about 36 weeks. So if you're going into labor before then, your doctor will administer steroids injections over a 2-day period. And the longer you can stay pregnant while having these steroids in your system, the better for the baby. Now, premature birth is very common. In South Africa, 8 in every 100 babies are born premature, and 1 in every 7 babies are born preterm. Now, don't despair. Babies born after 30 weeks pregnant have a 99% and above survival rate. But these stats are looking good because of things such as improved antenatal care practices, maternal health, and neonatal care. So please do stick with the antenatal visits, take the medications and or supplements that are recommended by your healthcare practitioner, avoid smoking, alcohol, and drugs, and maintain a healthy weight during pregnancy. Now, with only a few more weeks to go before I meet my precious, I'm struggling to sleep at night. Baby is very active when I decide I want to go to bed. So he will be stretching and punching and kicking when mommy wants to sleep. I find myself thinking of all the things I still need to do before baby gets here, and all the things I need to do once he gets here. I'm becoming aware that things won't be the same with my firstborn. The attention I give him now will probably lessen once baby is here, and I don't want it to happen. So I find myself having mommy's guilt and wanting to spend as much time with him now before baby gets here. And then the one that is mostly on my mind is all the wine I am going to enjoy once I have my body back. Now, I do plan on breastfeeding, so I'm getting a routine together and dusting off my breast pump so that mommy can enjoy her grape juice and still provide safe, clean breast milk for baby. I also think subconsciously I am having anxiety about Labor Day, but because of the overwhelmness of it all, I am not allowing myself to consciously think about it and talk about it. However, I will need to do so for our next video. So see you then.